Namaskar to everyone on behalf of entire team of the Pharmalo. Warm welcome to all of you. I, Dr. Shekhar Verma, would like to congratulate to all the pharmacy of pharma professional on the occasion of National Pharmacy Week. Pharmalok is also celebrating a National Pharmacy Week, and in the meantime, we are taking the technical knowledge from well-known scholars across the country to our audience through the lecture series for the 2 days. In this episode today we have such a personality, those who is do not need any introduction. He is himself considered as a school of pharmacy. He is not only worked in the field of pharmacy but also involved in various types of the social activities in his social work. He has spent more than 3 decades in the field of pharmacy. Yes, we are talking about Dr. Professor N. Udupa. Namaskar, sir. I
Namaskar.
welcome you on behalf of the audience of the Pharmalok and the Pharmalok team. Before we start the technical, uh, your technical lecture, I would like to tell a little bit about your visit so far in the field of pharmacy. Dr. N. Udupa sir has done his graduation B Pharm, M Pharm, and doctorate degree from the Banaras Hindu University, Ranchi. Then he worked in pharmaceutical industries for the 8 years. He has been worked in the academic for more than 3 decades. He is presently working as a research doctorate at Manipal University, Manipal. Dr. N. Udupa has more than 450 publications, 500 conference presentation, about 100 review articles, 15 books. As an editor, obviously, is an editor and a 15 patent and his credit. Dr. N. Udupa has received 57 grants of worth rupees around 7 crore. It is a very huge amount to get as an academician to get this much amount of financial grant. It is a very great honor for us. We have Dr. N. Udupa sir, and he has guided and supervised around 60 PhDs and 19 M.Pharm dissertation work. Dr. Udupa has received several awards, and a few of them are Pharmacy Teachers of the Year Award by 54th IPC Trust Pune in 2010, IPO Fellowship Award 2019 by IPA New Delhi, Pharmaceutical Scientist of the Year 2008 Award from IAPST in 2008, Association of Biotechnology and the Pharmacy Conferred Honorary Fellowship Award 2007 in Guntur, Principal of the Year 2001 award by APTI in 2001, Dr. P.C. Dandia Trust Research Award at Jaipur in February 1997, Stars Award 2011 at Bangalore in 2011, and many more awards in his credit. He has done not good in the field of the academics and research, but he served as the press the dynamic worker for the Rotary Club. He did a lot of social work for the poor people, for the society. He's not an academician. He's a good administrator and a very well-known researcher and a scientist. He served in the IDPL and the Citadel for the around the 8 years in the both the companies. And it's an honor for us. We have Dr. N. Udupa sir. Again, sir, I am welcoming you on behalf of the entire our Pharmalog team and the audience of the Pharmalog. Now, thank you very much. You are giving us time. It's nice to hear you, sir. Please over to come for your technical lecture. Sir, please.
Yeah, thank you very much, Dr. Shankar Verma, and also Dr. Jha for Praveen Jha, for giving me such a great opportunity to speak on the occasion of National Pharmacy Week celebrations. Actually, because I am also one of the executive and also editor of Indian Journal of Hospital Pharmacy of Indian Hospital Pharmacy Association. So the national valedictory of this National Pharmacy Week celebration and meeting is going on in Lucknow headquarters of and Delhi simultaneously. So it is overlapping. So I just joined and then I told I have to join and address another meeting and this Pharmacy Week celebration as a chief guest and keynote speaker. So that's why I am with you. So first of all, to all the pharmacy professionals, on my behalf and our all pharmacy professional behalf, I congratulate and also I wish great greetings and great success for your pharmacy profession. So actually today's topic what I am going to tell is emerging area, that is scope of clinical pharmacy in world and particularly for Indians, because clinical pharmacy, we started our PharmD program about 10 years back, and now around 300 to 500 colleges. Of course, in India, 5,000 pharmacy colleges are there, out of which more than about almost 3 to 5,000 diploma institutions are there, which are offering a diploma in pharmacy, and that is the minimum basic qualification to work as pharmacist, registered pharmacist. And now the emerging area is clinical pharmacy. So I want to highlight the scope of clinical pharmacy quickly in about 20 to 30 minutes. Before telling that, what is pharmacy profession and why this, what is the scope of pharmacy profession for all of us, I want to tell about this. The discipline of pharmacy has made enormous progress and has matured as a distinctly independent branch as pharmaceutical sciences, mainly through the acquisition of the wealth of knowledge, research, and vast array of drugs and therapeutic remedies. Unlike the other curricula, pharmacy is a product as well as service-related discipline, increasing its scope twofold. It is involved in the stages related to drug, from its discovery, development, action, safety, formulation development, usage, quality control, packaging, storage, marketing, etc. So the today's pharmacy professional is a drug expert in the real sense. The profession of pharmacy is called as a multidisciplinary curriculum. So no other curriculum is so vast as that is pharmacy, because we have technology, management, medicine, dentist, all areas of health sciences, all areas we are experts. The medication use process is generally involved as ordering, transcribing, reviewing, approving, consulting, dispensing, administrating the drug, documenting the whatever drug we are given, its interaction, etc. Then monitoring the drug and medicine what we have given to the human being through the prescribed and through doctors. The role of pharmacist is actually 7 essential roles of the pharmacist. World Health Organizations have defined for pharmacists 7 roles. He is a caregiver, health caregiver. He is a decision maker for administering the drug after knowing, diagnosing what is the disease, dose, etc. So he is the one who makes the decision. And he is a very good communicator with the patient, doctor, nurses. He is a leader for the healthcare team. He is a manager and entrepreneur because he can manufacture, store, distribute, market, etc. He is a lifelong learner. It is not just whatever degree he got and then because continuous education is required and daily learns. He is a lifelong learner. He is a teacher for everyone, to the doctor, nurses, to his own pharmacy professionals, his junior faculty, colleagues, and to the patients, and to the parents, to the caregiver. The 5 essential roles of the pharmacist. The Pfizer, one of the biggest, highest, top ranked, and which has got the highest turnover sales, highest manufacturing turnover, Pfizer. It has defined 5 essential roles for the pharmacist. One is drug discovery and medication safety, patient education, monitoring the drug therapy, teaming with the other healthcare providers, research and clinical studies. Then career opportunities for the pharmacist is from production to manufacturing with the GMP conditions, R&D for new drug discovery, etc. Then quality control and analyzing, testing, then marketing the all the products what he has manufactured. Then hospital pharmacy, because hospital pharmacy is big, it is a big organization industry. Every hospital has got a very big hospital pharmacy where drug distribution, manufacturing, dispensing take place. Then besides that, clinical pharmacy and community pharmacy, these are also the very important roles. Then in every hospital, there will be big hospitals, reputed hospital, accredited hospitals, as per the ICMR guidance and all. There will be clinical trials with the doctors and physicians and surgeons. Then some very good centers are there where bioequivalence, bioavailability studies are done. Then toxicological investigations are done. Some of the areas of clinical research which are in high demand, or they are involved in the systematic evaluation of potential drug substances prior to getting them approved by the authorities. Whatever drug is formulated and new formulations, they are not simply directly given. Even after quality control, the required toxicity studies and clinical investigation monitoring has to be done. There are 5 stages of clinical studies: phase 1, 2, 3, 4, preclinical, post-clinical, and pharmacovigilance, and even post-marketing surveillance also it is done. Then for the quality control of the product, every batch has to be analyzed, tested. Imported medicines also have to be properly tested. Any drug or dosage form for human use has to be of excellent quality and purity, free from any impurities. The permissible limits of impurities which either occur through the manufacturing process, equipment, raw materials, handling and storage are very stringent. The hospital pharmacy is opening for a pharmacy professional is as a registered pharmacy in the hospital for the drugstores. This is a key position. The hospital pharmacist position is a key position which plays an important role from preparing prescription to the patient's medication history after the medical doctor has diagnosed the disease. The pharmacist is the best informed qualified drug expert whose advice is sought by everybody regarding the dosage, incompatibility, and side effects of the drug. Then, even in the community pharmacy, through the services of community pharmacy, pharmacist becomes a vital link between the patients and the products and drugs. The pharmacist also serves as a vital link between the patients and other healthcare professionals, especially the medical experts. The role of pharmacist in community pharmacy is counseling the patients regarding the use of the drugs and dosage forms and medicines, providing up-to-date information on the drugs dosage form to the patients as well as medical staff, maintaining patient records and history, involving in the usage of self-diagnostic kits by the patients for disorders like diabetes, hypertension, etc., providing supply of home care dosage forms. The evolution of the role of the pharmacist, like it is in a transition stage in the healthcare. The specialized care, it starts from primary care, and from earlier it was we are not cost unaware, but now we are cost aware. Earlier it was institutional based, now it is community based. And earlier only it was for the acute treatment. Now we use it for the chronic management. From the individual patient to the prospective perspective. Curative care, now we also consider preventive care. Individual provide, now it is the team provider. And then earlier we are thinking that is the competition between various companies, hospitals, doctors, pharmacists. But now it is a cooperation. Everyone has to work together in synchrony. The specialties in pharmacy practice, in the board of pharmaceutical specialties are now various new specialties are there, super specialties like nuclear pharmacy, pharmacotherapy, nutrition support pharmacy, psychiatric pharmacy, oncology pharmacy for the cancer. The pharmaceutical care is responsible provision of drug therapy for the purpose of achieving definite outcomes that improve the patient's quality of life. These outcomes are cure of the disease, elimination of reduction of a patient's symptom, arresting or slowing of a disease process, preventing a disease or symptom. Now I am coming to clinical pharmacy. Clinical pharmacy is defined as the branch of pharmaceutical science dealing with the utilization of pharmacist knowledge, skills, and judgments related to biomedical and pharmaceutical sciences to prove the safety, cost, economics, and the precision of the drug usage in the patient care. The history of clinical pharmacy has started like this. The term clinical pharmacy was first used in 1953. The concept of clinical pharmacy started in 1960s with the two incidences. First, in 1962, the thalidomide tragedy, wherein it was found that consumption of popular sedative thalidomide resulted in birth of babies with sealed limbs. Second, in 1968, phenytoin toxicity was reported in Australia, which was because of change in formulation, switching over from calcium suitable to lactose and excipient in the tablets. Thus, in the European countries, Germany and UK and Sweden, Switzerland, and also in the USA, Canada, and then subsequently in Australia, lot of clinical. That's why in India, the clinical pharmacy for clinical pharmacology, pharmacy practice, this PharmD and all, we brought this particular new this subject from because from JSS Ooty and all. Actually, it is the Manipal College of Pharmacy where we started specialization M.Pharm clinical pharmacy long time back. Then, of course, with the Australian collaboration, JSS brought, and 15 years back we started PharmD program. Earlier to that, M.Pharm pharmacy practice was already existing more than 25-30 years, but now in last 15 to 20 years we are following this PharmD program, which is brought here from Canada and Australia. The scope of clinical pharmacy is preparation of the patient medication. Like first is the preparation of patient medication history. Any hypersensitivity or allergies to specific drugs observed in the past, any particular drug or food habits, drug dependence or intoxication with chemicals due to occupational hazards, all of which are likely to interfere with the therapy. This will help in saving physicians' time and efforts, and thus will result in faster and more accurate selection of the drug therapy. The rational prescription is one. The clinical pharmacist can suggest the physician and help in selecting right drug. Some of the examples of irrational combination identified by pharmacists are for haloperidol with diazepam, amitriptyline, reserpine with syntamil. These are all irrational combination prescription. The bioequivalence and generic equivalence of pharmaceutical formulation, number of factors influence the bioavailability and bioequivalence of the drug from dosage forms. Selection of proper drug therapy based on bioequivalence studies on different dosage forms of the same drug moiety is also possible. The patient monitoring. It is just not enough that just we give the drug and see the effect. We have to monitor the patient, whether he has got toxic symptom, any dosage adjustment is required, etc. The pharmacist observes the signs of symptoms that indicate the need for or reaction to the drugs. Clinical pharmacist who knows correct route of administration, signs and symptoms of overdosage, contraindication, desired effects, undesired effects, and side effects can help in monitoring the drug therapy or safety and efficacy. Necessary with the increasing application of potent and toxic chemicals and drugs. Drugs with narrow therapeutic index or when drugs administered in patients who are critically ill or are suffering from chronic diseases like for hypertension, which is hypertension and diabetics, like hypertension, diuretics are used. So there will be blood pressure changes, and for diabetes, insulin therapy is given. So urine glucose levels are to be monitored. The adverse drug reactions and drug interactions also are to be observed. The clinical pharmacist can compile and process data using computers and make it available to the medical staff. He may suggest an alternate therapy people claim. Identify the drug effect modification due to interactions with several foods, alcohol, smoking, environmental chemicals, as well as drugs, etc., due to pregnancy, etc. Then drug diagnostic test interferences can also be monitored by the clinical pharmacist. Intravenous administration also clinical pharmacist nicely he adjusts. Then as a drug information specialist, clinical pharmacist plays a very important role. A clinical pharmacist being an expert on drugs may operate a drug information service through effective utilization and retrieval of clinical drug literature. The pharmacist can actually communicate the drug information. He can help during medical emergencies, providing immediate information, antidotes in case of poisoning, overdosing, etc. The retail pharmacy stores, many OTC drugs have the potential to interact with the prescription drugs. A clinical pharmacist at retail drug stores can maintain patient drug profiles, family drug profiles, and family records based upon which the pharmacist can counsel the patient each time while filling the prescription. He can determine the patient's response to drug therapy and help him in the selection and use of OTT drugs. Discharging the counseling and the patient compliance. The compliance to drug therapy can be improved several times by educating and counseling the patient at the time of discharge from hospital or while dispensing the prescription at the state counter. The patient may be made aware of the purpose of medication, proper mode of administration, dosage schedule, and storage conditions. He may be told of any potential adverse or side effects to expect and any food or activities to be avoided during therapy. The clinical research and continuing education program. This is again very important aspect. The clinical pharmacist can participate in an evaluation program and investigational drug. He can help in conducting clinical trials based on sound principle of biostatistical methods of evaluation. He can also develop training programs of pharmacists, nurses, and interns. Then medical audit also, pharmacists help a great role. Medical audit is a logical, necessary procedure within organized framework. The clinical pharmacist is either the initiator or a very active member of a functioning committee. Following are the activities concerning the medical audit, like legislation, contractual obligation, regulation and registration of pharmaceutical orders and administration, regulation of clinical experiments with the drugs, information for subject and for patient, pharmacotherapy committee policy, regulation of information from pharmaceutical industry, local or regional micro symposia per patient, formulary policy, retrospect study of drug use patterns, medical audit committee work. Then legislation. The pharmacy is responsible for the quality of the medicine he dispenses. It is known as forensic pharmacy. Contractual obligation. The authorized pharmacist should be charged with the supervision over the maintenance of the organization, included involving the storage, distribution, and registration of the drugs, regardless they are in the pharmacy or elsewhere in the institution. Regulation and registration of pharmacotherapy orders and administration. Clinical pharmacy must provide the means for the pharmacotherapy. The follow-up should be reviewed by pharmacists with the head nurses and medical director. Specific problems should be discussed with the concerned members of the healthcare from the and they are regulated. So that is the concept of the pharmacotherapy. Regulation of clinical experiments and drugs. Regulation of clinical trial is very necessary to ensure that there are no ethical problems that may harm the patients. To control the clinical trial and to control the pharmacotherapy through registration and processing of requests for the use of unregistered drugs, for the purchasing policy, for control of the stock and turnover, for the quality control, for the supply, for the compounding, for the control of the code and key of the blind experiments. Because in all clinical trials, it is because there will be blinded different samples, different control as well as standard products. So the codes are maintained because the patient will not know what medicine from which company they are, and even the doctor will not know. They are coded. So this job is done by the clinical pharmacist in the hospital. The reporting of a deviation of standard operating and registration procedure will also be done by this clinical pharmacist. And he also gives the information for subject and for patient. Information for subject and for patient may be provided by clinical pharmacy. Information is a service and should be given unsacked for when deemed necessary, whether it is from nurses, patients, patient parties, or from the patient relatives, or from the doctor. So all these things should be given by the clinical pharmacist. The pharmacotherapy committee, in this information, specific subject policy is prepared within the multidisciplinary team and product as advised by the clinical pharmacist. And he will motivate and must ensure the continuity, and the pharmacotherapy committee in the hospital is very important. The clinical pharmacy requirements for the patient care is knowledge of the drug therapy, knowledge of the disease, knowledge of the laboratory and diagnostic. Its communication skills also is very important, and patient monitoring skill is very important. Physical assessment skills also are required, like blood pressure monitoring, diabetes, sugar monitoring, etc. And also drug information skills are required, therapeutic planning skills are required, knowledge of the all the types of therapy is also very important. The level of clinical pharmacy is clinical pharmacy activities may influence the correct use of medicine at three different levels: before using the medicine, after prescription, during the medication use, and after the prescription is written. Before the prescription, it is the involving the clinical trials, formularies, drug information, drug-related policies. During the prescription, counseling activity, clinical pharmacy can influence the attitudes and priorities of prescribers in their choice or correct treatment. The clinical pharmacist monitors, detects, and prevents medication-related problems. The clinical pharmacist plays special attention to the dosage of drug which need therapeutic drug monitoring, like antihypertensive drugs, then combination therapies, anti-diabetic drugs, and phenytoin, and lot of very potential like rifampicin, anti-tubercular drugs, gentamicin. So some of the very serious antibiotics, their clinical therapeutic drug monitoring is very important. So he should be thorough with the analysis and interpretation, etc. So there is a toxic level and the safe therapeutic level. All these things you should be very thorough. So counseling, clinical pharmacists, the correct treatments, clinical pharmacy detects, prevents medication-related problems. Clinical pharmacy place special attention dosage drug which needs therapeutic monitoring. Community pharmacists can also make prescription decisions directly when over-the-counter drugs are concerned. The medication-related problems are like untreated indications, improper drug selection, subtherapeutic dosage, like drug is not used in proper dosage is less. Then how we have to adjust medication failure, medication overdosage, adverse drug reactions, because they are like now there is a new subject is evolved, that is pharmacogenomics, because every patient is DNA, his constitution of the body, his RNA, DNA is different. So accordingly, the correct correct dose has to be selected. So that's why adverse drug reactions and all this monitoring, the clinical pharmacist will be thorough. Even pharmacogenomics, population related kinetics also you should be aware, because Asian population, then Chinese population, American population, European population, and all they react in a different way. The dosage requirements also different. That's why all these things only the pharmacist is thorough with these indications, this information. Then drug interaction, the medication use without indications, all these you should be very thorough. After the prescription is given, the counseling, preparation of the personalized formulation, as I already told on the pharmacogenomic line, drug use evaluation, outcome research, then pharmacoeconomic studies. This is another area. Pharmacogenomics is one, pharmacoeconomics, the cost-effective medication, because ours is a poor country, like all the Asian countries, particularly Africa, then India, Bangladesh, Pakistan, Nepal, Sri Lanka. We are all very backward economically, because even we take food and all only when we are hungry. So that's why for us it is not luxury. So that's why we have to see drug affordable, how best at a cheap economical cost, but the best medication should be given. So pharmacoeconomic studies, because in Manipal and some other places they have started, we have a specialization in MPharm, that is pharmacoeconomics. So many PhDs, I have also at least 3 to 4 candidates, they did PhD, MPharm PhD with me, and several papers, pharmacoeconomics, we have written books, chapters, etc. Dr. Nagappa Nayak and myself, we started a ISPOR, that is International Society of Pharmacoeconomics and Outcome Research. So in India also, we have started a ACPI association with ISPOR. We have got around 20 chapters, 10 student chapters, and actually we had also celebrated this Pharmacy Week celebrations yesterday. So I also spoke yesterday also. So like that, we have pharmacoeconomics is emerging as one of the pharmacogenomics and pharmacoeconomics. So activity of clinical pharmacists is consulting, analyzing the therapies, advising healthcare practitioners of the corrections of drug therapy, and providing pharmaceutical care to the patient both at the hospital and community level. Selection of the drugs, defining drug formularies, a limited list of drugs in collaboration with the hospital doctors, general practitioners, and decision makers. Drug information, seeking information and critically evaluating scientific literature, because the literature, it is very difficult. Everyone cannot, there is no time. So much information is there, drug information. Daily we get a lot of information. So only pharmacist, he has to screen, he has to filter and give according to the time and the particular place. The organizing information services, both the healthcare practitioners and the patients, is a very important role of responsibility of the clinical pharmacist. Then activity of clinical pharmacists are medication review medication chart, review medication history, then attending the rounds. Because in PharmD, from the first year itself, first year, second year, because 6 year program, PharmD is that's why they are called doctor in pharmacy, like MBBS, Bachelor of Medicine and Bachelor of Surgery, like that MBBS. So all those, the dental, Bachelor of Medical Dentistry, etc. Similarly, now PharmD, because B.Pharm, it is only a graduate, 4 year is like a technical person, B.Tech, so B.Pharm 4 years, whereas 6 years, 5 years, full semesters, and then about 10 semesters plus 2 semester project work, thesis work. So that is PharmD program, and they have to go make this hospital rounds, and then they have to review the medication chart, review medication history, then also drug use studies, pharmacoepidemiology studies, outcome research, pharmacovigilance, vigilance in medical devices, collecting data on drug therapies, their costs and patients' outcome through structured and scientific methods. Then the pharmacokinetics, clinical pharmacokinetics. It is also the role of the therapeutic drug monitoring, studying the kinetics of drugs and optimizing the dosage. The clinical trials involves planning, evaluating, and participating in the clinical trials in the hospital setup. The activities of the clinical pharmacists are also now increasing, like pharmacoeconomics, I already told, using the results of clinical trials and outcome studies to determine the cost-effective treatment. Then teaching and training also is very important. Pre and postgraduate teaching and activities to provide training and education programs for the pharmacists and other healthcare practitioners also has to be undertaken by clinical pharmacists. The information sources are medication records, the patient history, the family history, the healthcare team, then medical record. It involves admission of the admission information, initial history, physical examination, progress notes, consultations, nursing notes, laboratory data, diagnostic procedure, radiology, surgery, the prescription orders, medication history, administration orders, then consent forms. Because for all these clinical trials and all, there are hundreds of consent forms. There is a format. They are all website approved by the WHO, and in India, ICMR also has modified according to our conditions. The clinical practice, pharmacy practice areas are ambulatory care, critical care, drug information, geriatrics and long-term care, internal medicine and subspecialties, cardiology, endocrinology, gastroenterology, infectious diseases, neurology, nephrology, obstetric and gynecology, pulmonary diseases, psychiatry, rheumatology, nuclear pharmacy, nutrition, pediatric pharmacy, then pharmacokinetics, and then surgery. The practice guidelines for pharmacotherapy specialists are: the pharmacotherapy specialist designs, implements, monitors, evaluates, and modifies the patient pharmacotherapy to ensure effective, safe, and patient care. Then practice guidance for pharmacotherapy specialists are also like retrieving, analyzing, evaluating, and interpreting the scientific literature as a means of providing patient and population specific drug information to health professionals and patients. So these are all available from the statement from the American College of Clinical Pharmacy. The practice guidance of pharmacotherapy specialists also include the participation and generation of new knowledge, relevant to the practice of pharmacotherapy, clinical pharmacy, and medicine. The pharmacotherapy specialists educate healthcare professionals and students, patients, and the public regarding racial drug therapy. The pharmacotherapy specialists continuously develop his or knowledge, skills in applicable practice areas and demonstrate a commitment to continued professional growth by engaging in lifelong process. The clinical pharmacokinetics is the process of applying pharmacokinetic principles to determine the dosage regimens of specific drug products for specified patients. To maximize the pharmacotherapeutic effects and minimize the toxic side effects. The therapeutic drug monitoring stands for therapeutic drug monitoring. The clinical pharmacokinetics application of these principles requires an understanding of the absorption, distribution, metabolism, and exclusion, known as ADME. Then characteristics of specific drug products in specific diseases and patient populations. Just a few more information. Coming to end. Then responsibility of the clinical pharmacist is communicating patient specific drug therapy information to physicians, nurses, and other clinical practitioners and the patient orally and in writing and including documentation of this in the patient's health record. And also educating pharmacists, physicians, nurses, and other clinical practitioners about pharma and appropriate indication for clinical pharmacokinetic monitoring, including cost-effective use of drug concentration measurement. And also, pharmacists with specialized education, training, and experience may have the opportunity to assume the additional responsibility, like designing and conducting the research, clinical research, developing and applying computer program and point of care information system to enhance the accuracy and sophistication of pharmacokinetic modeling and application to pharmaceutical care. So, in a high rocket speed, I try to explain how the pharmacy profession, clinical pharmacy is helpful, and the future is like highly sophisticated pharmacogenomics, the population model for the related drug therapeutic monitoring, and also the pharmacoeconomics because cost-effective, affordable treatment. So this is possible only because the pharmacist is a custodian of the drug. So even without the drug, because see in some places, because I am next week I am going to give a herbal medicine at the pharmacist how he can be like in the lot of India is having more than 70 to 80 village rural rural area where the natural rich abundant natural resources are available, herbal and other medicine. So these extracts they can be prepared by him and then locally made and then they cost effectively they can be with the modern system and they can be given because recently what is the cost effective treatment Aishman Bharat scheme everyone has got the free for the poor people based on their economics and their budget we can give them treatment most cost effectively because treatment you can be made very free drug can be made very cheap so this is possible through this like that's why pharmacoeconomics is a very important role it is playing so as pharmacist clinical pharmacist even in the community level because everywhere hospitals cannot be so even the retail and dispensary because we are telling about the barefoot doctors but in India it is not the barefoot doctor it is the barefoot pharmacist. Not only food, but its hands are also working. So the barefoot and with the hands and with whatever even the wheelchair because there was a time when the rural pharmacy and all the patients and their party they have to come to the hospital now it is the doorstep we have to door how the vaccines now our Honorable Prime Minister Narendra Modi ji, he has seen that all of us are vaccinated, 2 times vaccination. We are successful in making 3 to 4 our own vaccines in India itself. We are able to export it So that all these things were even pharmacists was though nurses, doctors, and other people, physiotherapists, and all they were praised and they were telling that the doctor is the primary in the healthcare, but it is the pharmacist. He is like without him making any noise and without any name and fame, without any money, because he doesn't bother how much salary he gets and all. So that's why he has helped a lot, and nobody is our pharmacists are not recognized. That's why this Pharmacy Week celebration is every year. Even WHO and USA and all, they started FIP, World Pharmacy Congress Association, is where I am also member, and India's chapter. I am one of the representative, one of the executive committee member. That is, we have made a policy now. Every year, September 15th, we celebrate National Pharmacy Day. This is every year, November, from last so many years, we are celebrating National Pharmacy Week celebration. When pharmacy course started from Banaras University, when I joined BPharm course in 1971 onwards, every year, National Pharmacy Week, initially I was attending at all, but last about 20 to 30 years, every year I have chief guest or all that in rallies and giving lecture, writing articles, special issues, books, and all these things that we are doing. So that's why that awareness about the pharmacy, because the society, patients, they don't know what is this pharmacist, because they think pharmacy means a farmer, like that. But of course, we have to cultivate, grow medicinal plants, take medicine, natural medicine, and also dispense and all. So besides food, drug, as a nutraceutical, cosmeceuticals. So we can do a lot of other things also, but medicinal use, because cosmetics, nutraceuticals also we consider they are very for the rich people at all, whereas vitamins and all for the strength and all. So that poor patient cannot afford. That's why we have to see that these are made affordable. Essential medicines are made affordable. So pharmacist plays a very important role. So that's why as a clinical pharmacist, there is a lot of scope, lot of jobs are there. So everyone will get a better promotion, better job and all. Let us see that we all of us serve the society. So that's why the Pharmacy Week celebration is the message we have to spread. Our importance has to be, we have to showcase the pharmacist role. So thank you very much for patient listening. And any questions, anything, you can mail me, you can WhatsApp me, and also now also I am ready to answer you question. Anybody can ask any question. I am ready to answer. Thank you very much for giving me this great opportunity to Dr. Mr. Jha and Shankar Verma, and for the whole Pharmalok world for giving me this great
Thank you.
opportunity.
Thank
Thank
you,
you.
sir.
Thank
Thank you. Thank you
you.
very much. Really nice to hear you. And within hour, you have nicely and very uh, peacefully, fruitful, elaborated everything about the scope of clinical pharmacy profession. And not only the clinical pharmacy profession, you have explored everything about the pharmacy. It's your experience. You talked about the pharmacovigilance, you talked about the pharmacogenomics, economics, and everything. And you rightly said about the what are the scope and role of the pharmacist. And we have seen already during this pandemic outbreak, our pharmacist, our pharmacy professional, not only the pharmacist, all pharmacy professionals are did commendable job. They did very commendable job. They served very well. They manufactured a drug in very short period of notice. Our pharmacists played very well during the drug dispensing and in the hospital, in the medical store also. And it's nice to hear, sir. And you spare your valuable time. You give your valuable time, and your talk is you. I think you are around 36-year experience, and it's honor for us. We have Dr. N. Udupa sir today in our Pharmalok, and definitely, sir, in near future we will try to meet again. You will try to listen you again. Thank you very much, sir. Once again, thanks.
Thank you. Thank you. Thank you. Thank you. Thank you. Bye. Bye. Bye.